All right, welcome back, everybody. I think we'll get going with our sort of didactic portion, but I hope everybody's feeling well and had a good experience. It's very interesting to see the shift in everybody before and after your acupuncture treatments. It's really very interesting from this standpoint also to do. So I hope that was a good experience for you all. So I'm Dr. David Miller, and I wanted to speak to you today about sort of the scope of the opioid crisis and why we're advocating for acupuncture as a key piece of the solution to that opioid crisis. And we have 4 speakers today. Dr. Jun Xu will speak after me on what's being done with acupuncture in China today to give you a sense of how this has already been integrated into their healthcare system, actually for many years. So it's not a task that's hard to do or impossible to do. In fact, it's already been done, and we can copy if we need to. Dr. Arthur Fan is going to speak to you about the educational standards for practitioners coming out of China, because they go through a different educational system, but it's a very strong education. We want you to know what their practitioners learn. And Dr. Tracy Soltis is going to speak about the training for licensed acupuncturists in the United States, so that when you're choosing a practitioner, she'll give you an idea of what to look for and why choosing a licensed acupuncturist makes a lot of sense, as the training is impressive. So to start just looking at the scope of the problem, more than a third of Americans report pain, right? So 25.3 million Americans suffered chronic pain, and 126 million American adults reported some type of pain. So that's a third of the population is reporting this. And so the scope of the problem, something has to be done. It's a chronic condition. It's a chronic state of being human that we have pain. How are we going to manage that pain in the safest and most cost-effective way possible? So up till now, and increasing over the past decade, opioids have become the go-to solution. And there's a number of reasons why that happened. Some misunderstandings about the safety profile of opioids was a big portion of that. But nonetheless, doctors were prescribing more and more opioids, and patients were getting more and more addicted. 80 to 94% of patients undergoing low-risk surgical procedures would fill a prescription for opioids within 7 days, right? Not necessary. There are other ways to control that pain. So instead of getting relief, our population is getting actually deaths. So more than 33,000 Americans died in 2015 from opioid drugs, and more than 64,000 died in 2016. The human burden of this epidemic is profound, and we heard from Terry earlier about that, and it's almost unfathomable that more people will die from opioids or have died from opioids than they died in the Vietnam War. So just a phenomenal burden on the population. So because of this, of course, August 31st was declared Overdose Awareness Day, and the president also recently declared the opioid epidemic a public health emergency. I thought this graphic was quite interesting. So opioids are expensive. They're expensive emotionally, cost of human life, quality of life. But this is looking at where the most opioids are prescribed, coupled with the loss to the job force. So when we think about the economic burden of opioids, right, people are not taking their opioids and going to work and working well because they're not in pain. What's happening is they're getting addicted to opioids and they're dropping out of the workforce, and then we have to support these people out of the workforce as well as try to help them get better if we even can. So the economic burden of this is estimated to have been $78.5 billion in 2016. So I often hear that, well, it's a lot to add acupuncture to people's treatment plans, you know, it's too expensive, how can we do that? We cannot afford not to do this. It's way less than $78.5 billion to incorporate this therapy into care. The attorneys general just put out a statement urging insurance companies to improve coverage for opioids, which is unprecedented. And a very large number of these professionals banded together to make this request. And this is really what we need. We need people from Congress. We need the attorneys general. We need physicians and hospitals, everybody saying we have to change our protocols. We have to change our infrastructure to be able to incorporate non-pharmacologic methods of pain control. And acupuncture stands as a shining star of one of the things that needs to be included in order to achieve that goal. So why acupuncture? Why does acupuncture stand out? There are a number of reasons physiologically that acupuncture stands out. I'm not going to give you a lecture on the physiology today, but acupuncture causes the release of endogenous opioids. It helps to modulate pain perception and thresholds, and it helps to change the way we process our physical experience. And it has been effective. And I want to show you that there is some good data to show that. There's a very large study of 454,920 patients, and looking at their use of acupuncture for a number of very common conditions: back pain, neck pain, shoulder pain, chronic headache, osteoarthritis. Right? And so they treated these people with acupuncture and surveyed their physicians to see what the physicians thought. Did they think the acupuncture made a difference in their care? And 76% of physicians said, yes, this seemed to be effective for my patient. They got better. It was a meaningful component of their getting better. A systematic review and meta-analysis, which is sort of the highest form of evidence that we can gather, looking at acupuncture for sciatica pain, another super common type of pain that many of us will experience throughout our lifespan, or at least at times, that acupuncture was superior to standard pharmaceutical care, pharmacologic care, in reducing both the intensity of the pain and patients' tolerance of pain, their pain threshold. Acupuncture was second in global effect only to biologic agents in another study, superior to all other interventions, including non-opioid and opioid medications. In plantar heel pain, also, an everyday kind of pain, acupuncture was found to be comparable to standard care. And so that's important to recognize too. When you're choosing how to treat a specific condition, you have options on how to treat them. And you want to treat based on what's safest, what's most cost effective, and also what connects with the patient. Patients have to connect with their treatment, or they won't follow through with their treatment. And if you can't follow through with your treatment, you don't get better. So we have options. So acupuncture shows that it could stand up and be an equal player in the options that patients have, and be equally comparable in its effectiveness. Interestingly, too, as well, sometimes opioids are needed. Sometimes they're the right choice for pain control. But then if they're going to be the right choice, we need to minimize the amount of opioids we're going to use. So you don't have to use opioids in isolation. They did a recent study in JAMA Surgery and found that that acupuncture was useful as a non-pharmacologic treatment in reducing pain after knee replacement surgery. So they looked at 39 randomized clinical trials, 2,391 patients, and they found that electroacupuncture, electrotherapy reduced the use of opioids and delayed opioid use as well. So they were still getting the opioids, but they didn't need them as quickly, they didn't need them as much, and so they were able to lower the burden, which lowers the risk of addiction. So a similar kind of study, too, showed that acupuncture integrated in the emergency department, looking at acupuncture versus morphine to treat pain in patients appearing in the emergency department, that acupuncture provided more effective and faster analgesia than morphine and was better tolerated. So they looked at 300 patients, 150 patients in each group. Minor adverse effects in the acupuncture group compared to the morphine group too, which is not surprising. Acupuncture is extremely safe, which we'll talk about shortly. So there's some interesting studies that have done looking at the need for opioids after surgery. Some studies have reported reduced consumption by as much as 60% after surgery when you use acupuncture. And there have been some phenomenal studies coming out of the military too. How do we treat our military personnel, both active and veteran? And one of these studies showed that acupuncture dramatically decreased the use of opioids. We saw opioid prescriptions decrease by 45%, muscle relaxants decreased by 34%, and NSAIDs decreased by 42%. So quality of life measures also improved. So that's the other component of acupuncture that's so important to remember, is it's decreasing the pain, it's helping the patients get better, but it's also causing some global improvements in the patient's health. And you don't see that when you give pain medication, right? You don't see their mood get better necessarily when you give pain medication. You don't see their digestion improve, their menstrual cramps go away, whatever it is. Acupuncture does has a synergistic effect on multiple systems at once, and so you see more global improvements. So is acupuncture cost effective? And the answer is, when good studies are done, it does appear that acupuncture is cost effective. It's not going to be, the perfect choice for every condition, but for pain conditions and for a number of other conditions, the more we look at it, the more we say, wow, acupuncture actually really could save us tremendous money. Acupuncture was noted to save $35,000, $32,000, $9,000, and $4,000 for migraine, angina, osteoarthritis, and carpal tunnel syndrome, respectively. So that's a big savings in terms of care. And an interesting study coming out of Massachusetts showed that insurance coverage for acupuncture would only increase an average insured member's monthly health insurance by somewhere between 38 cents and 76 cents. So it's not expensive relative to what we're doing, because we have to remember that when we perform acupuncture, we're not doing something else, and that something else is often much more costly, right? So the average savings ends up being quite great. Looking back at that study with the 454,000 patients looking at acupuncture safety, only minor adverse events were reported in 7.9% of the patients, and only 0.003%, 13 patients out of 454,000 had severe adverse events, and some of those were also not entirely severe. So hypertensive crisis, and asthma attack, aggravation of suicidal thoughts, sort of odd things that it's hard to tell if it was causal or not, but also things that can be managed. The patients didn't die from acupuncture. Nobody dies from acupuncture, performed correctly by a properly trained individual. And that's an important thing to remember. So can acupuncture also help treat addiction? What about when someone's already addicted to opioids? So as far back as 1978, it was demonstrated that acupuncture decreased markers that we could measure, markers of stress, in heroin addicts compared to observational controls, compared to people not addicted, or people addicted not getting treatment, to be correct. And that's a really important thing to note too, because we have a group of people who are already suffering from opioid addiction, and how are we going to help get them off? We heard Terry's compelling story earlier about how maybe that could have been a part of her son's treatment plan, so that that he had some options, and he even reported that he found it helpful and then didn't have access to it, which is criminal, really, I think, at this point, when we look at the evidence and we look at our knowledge base and the accessibility and availability of acupuncture. In 2014, there was another study demonstrating that acupuncture decreased the amount of morphine used by addicts in treatment and simultaneously improved their sleep. So they got better sleep and needed less morphine. So acupuncture also may be able to treat addiction through a number of methods. There was a meta-analysis of studies done in 2012 concluding that the majority of studies did agree on the efficacy of acupuncture as a strategy to treat opiate addiction, and that they looked at different neurochemical and behavioral evidence looking at how it might be affecting key portions of the brain involved with emotional processing and addiction. Mesolimbic dopamine neurons were affected by acupuncture. Acupuncture also changed the balance of GABA, which is a calming, soothing type of neurotransmitter that makes us feel like everything's okay. So I just want to take a moment too, and we're focusing on pain. We're focusing on pain because we're focusing on opiates, but pain is a symptom of many things, and the goal is not to just treat people's superficial pain, right? Pain is what we would call the branch in Chinese medicine rather than the root. And so I want to emphasize that there's very good evidence showing that acupuncture can also treat the root of some of these conditions, so that people don't go back into pain, and so that you don't need to treat pain again at all. So finding evidence for even treating things like allergies, side effects of chemotherapy, headaches, some things, post-operative pain, but also a whole host of things like dry eyes, hypertension, and insomnia, irritable bowel syndrome, things like that too. We want to be thinking of acupuncture as an option. So acupuncture is available, and I think we should also be thinking this as a source of jobs creation, of economic development. We have a workforce of approximately 34,400 right now of trained acupuncturists in the United States, with an infrastructure in place to train many more quite quickly if needs be. They have to go through the whole program, which is a multi-year program, but the infrastructure is already there. We can direct them into that infrastructure if there are jobs for them on the other side. If we have sensible reimbursement and fair reimbursement for these individuals, then more people will choose this as a career path, and it will become more available. The other panelists today will be talking to you about some of that infrastructure, both here and in China, and what that looks like, so you can get an understanding of the quality of the education and the certification testing to assure competence. So while we look at this complex problem, we want to recognize, and the acupuncture community really recognizes too, that acupuncture is not the only solution. You're not just going to give people a couple of acupuncture treatments and solve the opioid epidemic. We understand that this is a team effort that needs to be made, and we need to all be working together to do that and use all of our mechanisms. But we have this tool at our hand, and we're not utilizing it, and we could be utilizing it right now, and we could be utilizing it much more. So we'd like to urge that acupuncture really be incorporated into medical systems so that it can become available to patients, so that we can avoid tragic outcomes and treat people who are already suffering. So if you have more questions about this, Dr. Callie Guymond can be our contact person for that, and you can also contact me, and we'll make sure that you get any information that you need. There's been a recently published white paper as well on acupuncture's role in solving the opioid epidemic, and this is available online. It is referenced, so if you search for it, you'll be able to find the article, and it's an open access article too, so you can download that and take a look at that.